In this video, we examine the effects of lycopene against cancer. As always, these ideas are discussed in more depth in the book Cancer Self-Defense 101, Quick Tips to Help You Survive. All citations for studies quoted in this video can be found in the book's bibliography at cancerselfdefense101.com. This video is intended as information, not medical advice. It is not intended to treat, diagnose, or cure any disease. Any medical advice should come from an appropriately credentialed medical professional familiar with your unique circumstances. Lycopene is a red carotenoid found in ripe tomatoes, grapefruits, and watermelons. It accumulates preferentially in the prostate and is a strong antioxidant. Other antioxidants, as profiled in our antioxidant video, have been found to have a negative effect on cancer outcomes. So why does lycopene have a positive effect on prostate cancer? Speculation is that it is probably due to the preferential accumulation of lycopene in the prostate and the slow-growing nature of prostate cancer. Typically, antioxidants would actually allow cancer cells to shuttle out reactive oxygen species, ROS, from inside their membranes. Many anti-cancer treatments work by raising ROS levels because cancer already has an innately high level of ROS and is not able to handle the increases. In this case, it seems the benefit, due to reducing genetic mutations with antioxidant supplementation, outweighs the potential danger of reducing ROS. Additionally, lycopene also inhibits androgen receptor expression. Like breast cancer may be an estrogen-driven cancer, prostate cancer may be an androgen-driven cancer. Whatever the dominant mechanism of action, there is ample human evidence for lycopene's efficacy against prostate cancer in human and animal trials. There have been a handful of small trials of lycopene used in other cancers, but there is nowhere near the level of evidence as there is in prostate cancer. Not every trial against prostate cancer shows a positive outcome, but about 4/5 do, and the rest are essentially neutral. Human evidence for the efficacy of lycopene in prostate cancer includes, relative to placebo, lycopene-reduced PSA levels and prostate size in men with benign prostate hyperplasia, a condition that puts men at risk for developing prostate cancer. In newly diagnosed prostate cancer patients receiving a prostatectomy, 3 weeks of daily supplementation with 30 milligrams of lycopene was also found to reduce prostate tumor size, lower PSA levels, and reduce the involvement less extraprostatic tissues with cancer, lowering chances of metastases. Lycopene increased the PSA doubling time 260% over placebo, meaning a much slower progression of disease in men with rising PSAs who had a radical prostatectomy. Lycopene concurrent with castration doubled response rate over just castration in prostate cancer. The mortality rate in the lycopene group was 22% compared to 35% in the castration-only group. In progressing, hormone-refractory prostate cancer lycopene supplementation led to stable prostate-specific antigen, PSA, levels in 29% of patients. Lycopene is safe and has no adverse effects in healthy people within a dietary dose of 3 grams per kilogram per day, much higher than the 30 milligrams per day people normally take. 2 meta-analyses of population studies involving hundreds of thousands of participants have found that higher levels of lycopene are associated with a decreased risk of developing prostate cancer. The threshold for achieving a significant impact in reduction in prostate cancer incidence is between 9 and 21 milligrams per day of lycopene. 30 milligrams per day seems to be the sweet spot for supplementation, as 45 milligrams per day was found to increase estradiol, an aggressive form of estrogen linked to increased cancer incidence. Lycopene has also been shown to synergize with sulforaphane, described in the cruciferous extract section, and curcumin. For more information on lycopene, see the book Cancer Self-Defense 101, quick tips to help you survive.